Hello, everybody. Hope you are all doing well. Today we will talk about interviewing and assessment. Okay, first of all, we have to know that patient assessment is an important aspect of patient care because when we assess the patient's understanding of his state and his medications, then we can ensure better outcomes and this can improve the quality of life. We have to determine what patients understand about their medications, how they are taking their medications, how well their medications are working, and what problems they perceive with their therapy. So, interviewing is one of the most important methods, that used to assess the patient understanding. Okay. Pharmacists often must obtain information from patients as part of the patient assessment process. So, inquiries of information range from simple requests such as asking a direct question that the patient will answer with either yes or no, like allergy to penicillin or other medications, or may be a complex problem such as determining whether the patient is taking a medication properly or not by asking, for example, describe me the way you are taking your current drug. So the initial assessment is so crucial to determine how much the patient know about his current state and medication. So we mean that initial assessment will provide us with what is the patient already know about his state. We have always to try to fill the gap rather than repeating the information we already know. Instead of wasting the time with repeating such information, we have to focus on filling some gaps. For example, if the patient is telling us about the method of taking his medication, and we didn't get a specific point, for example, we have to ask him directly about it. By assessing the patient knowledge, we can then do the patient education, which is vary depending on the depth of patient understanding of his state. So if the patient does not know anything about his medications, then the patient education will be more complex. Conducting an effective interview is not a simple process. Now, to ensure an effective interview, there are some components that is so crucial in this process. First of all, are listening. So, listening is very important. We have to know that people are better senders of info than receiver of info. Okay. يعني احنا معظمنا يعني لما بده يوصل المعلومة بيكون كعملية أسهل عليه من إنه يستمع لشخص آخر أثناء توصيل المعلومة لمدة طويلة. Nothing will end an interview faster than having patients realize that you are not listening to them. So listening is so important again. Now, to ensure listening well, we have some techniques that should be achieved. First, stop talking because we cannot talk while we are listening. Okay. Second, get rid of distractions. Distractions may break the concentration between the two sides. So if you are busy with your friend or with your phone, you have to put it down and listen well to the patient. Use good eye contact. You have to look directly to the eyes of the patient you are talking to. This will help you concentrate on the topic and on the issue, and this will show the patient that you are a good listener and you are caring about talking about this topic. React to ideas, not to the person. This is an important point. You have always to focus on what is being said rather than the patient himself. Some pharmacists may have bad experience with some people or with some patients, and they do not like them. But here we should separate between this issue at the time of communication. We have to focus only on the topic rather the patient himself. Read nonverbal messages because nonverbal messages may convey and communicate the same or different message than the one given verbally. Sometimes the patient may say something, but he conveys the opposite of that thing nonverbally. So you can get to this point, and then you can behave in some way. Listen to how something is said. The tone and the voice, the tone of voice and the rate of speech are also important during the message transmitting. So if the tone of voice is so loud or so quiet, this may indicate something different from what is the patient is saying. And the rate of speech also may convey some points. For example, you can know that the patient is angry, or the patient is sad, or feeling bad, or etc. Provide feedback to clarify any message. This is an important point. You have to show that you are listening and trying to understand. So by repeating some points to the patient, he can understand that you did listen well to him. Now, the second component during the interview is probing. What is meant by probing is the use of questions to elicit needed info from patients or to help clarify their problems or concern. يعني نسأله أسئلة عشان ناخد منه المعلومات. There are some consideration before asking a question. You should avoid why in phrasing a question. For example, people might become defensive if they ask, why do you miss doses of medication? Instead, you have to phrase the question as follows: what causes you to miss doses of medication؟ يعني لما بنسأله إيش الأسباب اللي بتخليك تنسى الدواء، أفضل منه ليش بتنسى الدواء؟ يعني بحس إنه هون نوعا ما يعني زي كأنه بتحقق معاه، فهو بده يصير دفاعي في الجواب. Another consideration before asking a question to a patient is the timing of a question. You should avoid several questions at the same time in succession, because this may leave the patient with the sense of being questioned and therefore may raise the level of defensiveness. يعني ما تخلي تتابعه كتير بالأسئلة عشان ما يحس إنه هو بموقف يعني بتحقق معاه وبصير دفاعي أكتر. Okay. عشان هيك so the patient should be allowed to finish answering the current question before heading to the next one. Avoid leading a question. This is an important point. What is meant by leading a questions? Questions that have already the answer within the statement or the question. So these questions strongly imply an expected answer. For example, you don't usually forget to take the medication, do you? Or you take this 3 times a day with meals, right? طبعا هنا الأسئلة هاي بتخلي المريض يحكي yes or no من دون ما فعليا يجاوب على السؤال فعلا مثل ما هو بيعمل. Okay? So these are leading questions that should be avoided. Differences between open and closed-ended questions. بدنا نعرف إنه open-ended questions اللي هي بتسأل patient those asking the patient about the method he takes the current medication, but closed-ended questions that should be start is or are. So the answer will be yes or no. Sometimes we need to use the combination of open-ended and closed-ended questions to make the meeting more efficient. So you may initiate with an open-ended question, and then we can follow them with the closed-ended questions. يعني ممكن نسأل أسئلة مفتوحة، المعلومات اللي بناخدها خلال الأسئلة المفتوحة خلص نحصل عليها. الإشي اللي بيضل missing ما بنكون أخذناه من الرد تبع المريض ممكن نسأله عن طريق yes or no questions. Here is an example. If you want to know whether Mr. Raymond is experiencing whether some side effects from his antihypertensive medication, then you may ask him, how have you been feeling since starting this medicine? Or what things have you noticed since beginning this medication? These two questions are example on open-ended questions. If necessary, open-ended questions that can be followed by more focused or direct or specific questions that ask about specific side effect related to the medication, like asking, do you have trouble sleeping? So he will ask about the side effect of insomnia. Do you feel weak? Do you feel tired? And so on. For new prescriptions, try always to use the open questions rather than the closed-ended, because this is a new patient and you have to assess the patient understanding about his new prescription. You have to ask him, for example, what did your doctor tell you about your medication? And for example, what did your doctor tell you to expect? And so on. Okay, what about asking sensitive questions? Some questions that we may ask to patients are sensitive. For example, some questions that assessing adherence or alcohol use or some drugs. For example, if we are going to ask a patient about the adherence, before that, there are some techniques that may help asking such questions. For example, generalized approach. For example, we have to say, it is very difficult to take a medication consistently day after day. Nearly everyone will miss a dose of medication once in a while. Okay? Some other examples of universal statements. This is a very common concern, and you then start talking about this concern. Frequently, my patients have difficulty in كذا 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 كذا. ممكن نحكي about يعني نحكي عن المشكلة. Everybody has trouble with something. بنذكره نفس الشيء. فهاي خلينا نحكي التهيئة بهاي الطريقة بتخلي وقع السؤال عليه أسهل. Okay, so what about asking sensitive questions? Sometimes we have to ask patients about the questions, but these questions may be sensitive. So, first, we have to ask whether the situation has ever at any time occurred, and then we have to ask about the current situation. For example, we cannot ask the patient directly, do you currently smoke marijuana and how much if you are? This way should be avoided. Instead, we can ask him, have you at any time in your life smoked marijuana? If the answer is yes, then you can follow with another question and to put things in a more recent time frame. Have you smoked marijuana during the past year? This is a sequential way to get you the information you want. Okay. During the interview, try always to embed more threatening topics among less threatening topics and to ask more personal questions later in the interview. يعني لا تسأل دائما عن الأشياء الحساسة والpersonal questions at the beginning. Avoid asking these questions at the beginning. You have to delay them later during the interview. For example, questions about alcohol consumption may be better accepted if the patient is asked following questions about caffeine consumption. Sometimes it is helpful to discuss the reason why you are asking a particular sensitive question. For example, people often do not think of alcohol as a drug, okay? But there are many medications that can interfere with alcohol. So you may discuss this point. I ask about alcohol use so that I can help you to prevent problems with the medications you take. By explaining the reason you are asking about alcohol, you may explain that he can answer it honestly and take it easy. Okay, sometimes we have to use silence. For example, we have to use pauses as necessary during the interview. Okay, sometimes the patient needs time to think about or react to the information you have provided or the question you have asked. Sometimes he might start to remember about his schedule or something else. The pause might be due to the fact that the patient did not understand the question completely. Okay, so sometimes the pauses that comes from the patient are due to not understanding the meaning of a question or the purpose of the question. In this situation, the question should be rephrased. So when you realize that the patient did not get the point, it is your turn and your role to restate or rephrase the question. You may tell him, for example, in other words, I mean, optbellished, and then continue your question. Avoid the temptation to fill empty spaces in the interview with unnecessary talk. If the patient is in pause or is thinking about something, do not try to break this silence by talking about unnecessary talk. It is just a silence and no need to talk during it. Sometimes you are the source and you are the silence maker. Okay, يعني أحيانا أنت اللي بتضطر تصمت. But too much silence when a patient is expressing feelings such as fear or depression may be interpreted by him as rejection. Responding with empathy is necessary. So do not try or avoid too much silence during the interview. Establishing rapport is a component that is important in the interview process. You should make sure that always you have a high degree of rapport between you and your patient. The cornerstone of rapport is the respect. You can aid this process by using good eye contact, sincere, friendly greeting, by being courteous during the discussion, and not stereotyping or prejudging the patient. Always try not to judge the patient by himself. Consider each patient as a unique individual. Now let's move to the interviewing itself as a process. What are the interview considerations that should be taken? First, type of info to be gathered, type of environment, starting the interview and ending the interview. Okay. Type of information. The interview approach should be based on the amount and type of information desired. We have two approaches, the directed interview approach and the non-directed approach. In the first approach, you need to find out specific pieces of info by the patient. You need more control on the interview. For example, you are the one who asked questions, and you are the one who will get the information from the patient. So you have the control. يعني أنت بمعنى آخر اللي بتسأل وهو اللي بيجاوب، وهدفك إنك أنت اللي تحصل على المعلومات. The non-directed approach, unknown or unclear outcome, the point of the discussion raised by the patients rather than by you. يعني عادة المريض هو اللي بيسألك وهو اللي بيعطيك المعلومات، مش أنت اللي طلبت منه يعطيك هاي المعلومات. وبعد ما يعطيك معلومات معينة بتظهر على الساحة، بتصير تظهر اللي هي المعلومات اللي أنت رح تاخدها. تمام؟ بس هي منشأها المريض نفسه. Now, type of environment provides as much privacy as possible. Try always to speak to the patient in a separate and private space. The degree of privacy has been associated with patient understanding and adherence. Before you begin the interview, reduce interruption as much as you can. Design a partition at the end of the prescription counter, a special room, or a counseling area. Now, starting the interview, you should start the interview by greeting the patient by name, introducing yourself to him if this is the first time you meet him. State the purpose of the interview, outline what will happen during the interview. For example, you can mention the purpose of the interview, the time or the amount of time needed, the subject to be covered, and the final outcome after the interview that you expect. Now, take this example about how to start the interview. Hello, Mr. Raymond. I am Rania, your pharmacist in this pharmacy. I want just 5 minutes from your time to talk about your new prescription. I expect you after this interview to get all the information needed to know how to use your medications. بس هاي بتكون هي عبارة عن المقدمة. طبعا إذا بدنا نترجمها باللغة العربية بنحكي أهلا فيك، أنا صيدلانية رانيا الجمال، رح أكون معك خلال 5 دقائق أخذ من وقتك بس عشان أعرفك عن الأدوية الجديدة اللي أنت رح تمشي عليها. طبعا الهدف من هاي المقابلة أو هاي يعني الكلام اللي بدي أحكي لك إياه إنه أنت بس تتعرف على الأدوية تبعتك وعشان تعرف كيف تستخدمها استخدام صحيح. طبعا هاي كمان مثال آخر ممكن أنتم تطلعوا عليه اللي هو ببين لك اللي هو greeting و introduction of the pharmacist himself, subject to be covered, the amount needed, and the purpose or the outcome. Okay, there are some suggestions that may help you during the interview to bring to make an efficient interview. First of all, avoid making recommendations while you are gathering information from the patient because this will prevent him from giving you all the information needed, and this can interfere with your ability to grasp the big picture of the patient needs. Okay. يعني خلينا نحكي بتضيع الفوكس الرئيسي وبتخلي المريض شوي يمتنع إنه يعطيك المزيد من المعلومات. Moreover, do not jump to conclusions or rapid solutions without hearing all the facts. أوكي، لأنه ممكن إحنا نفقد نقطة معينة أوكي ونعطي conclusion خطأ وكمان هاي برضو بتأثر على relationship بينك وبين المريض. Number 3, do not shift from one subject to another until each subject has been followed through. Number 4, as we said before, guide the interview using a combination of open and closed-ended questions. Keep your goals clearly in mind, but do not let them dominate how you go about the interview. Flexibility is required. The patient must have some control over the communication process itself. You should get the information you need, but without showing the patient that you are just giving him too much questions. بحس حاله يعني المريض خلينا نحكي بمعنى آخر زي كأنه أنت اللي بتسأل لحالك، أنت اللي عامل الكنترول لحالك، أنت اللي عم تعمل زي تحقيق معه. Determine the patient's ability to learn specific information. Reading ability, language proficiency, and vision or hearing impairments would all influence the techniques you use in interviewing and counseling a patient. طبعا بين هاي كل واحد له يعني اختلافات عن الآخر، قدرات qualification غير، في ناس ممكن عندها مثلا إعاقات معينة فبدنا إحنا يعني نتكيف معها بحيث إنه طريقة تزويدنا بالمعلومات لهم رح تختلف حسب احتياجهم. Maintain objectivity by not allowing the patient's attitudes or beliefs to influence your thinking. خلي أنت دائما الثينك تبعك oriented to the subject أوكي وتكون أنت مركز على الإشي اللي إحنا بدنا نعمله discussion وما يأثر عليك أي اعتقاد من المريض. Use good communication skills especially by probing, listening and feedback components. Be aware of the patient's nonverbal message as we said before because this signal how the interview is progressing. Note taking should be as brief as possible. ما نبين للمريض إن إحنا نكتب كل إشي بس هي رؤوس أقلام. Okay. Now we will end the interview. So how ending the interview? Conclude the interview with a summary. People seem to remember best what was said last. يعني حاول إنه آخر جملتين 3 يكونوا ملخص. طبعا الناس عادة بتركز بالملخص لما تحكي له يعني أنت المطلوب منك الآن كملخص هون ببلش يركز يعني لو كنت حاكي معه 5 دقائق آخر دقيقتين هم اللي بيعمل فيهم focus أكتر إشي. Care should be taken not to end the interview abruptly or to rush the patient out the door. Review what has been discussed and clarify misunderstanding. بتسأل المريض you can ask him if there is something that he does not understand well. or may ask you about. Provide time for you to ask patients to repeat key information. ممكن تحكي له مثلا repeat the time that you will take this medication. احكي لي أي ساعة اتفقنا إنك تاخذ الدواء. Okay. For example, you could say to the patient, I want to make sure I have explained everything clearly. Please summarize for me the most important things to remember about this new medicine. أو مثلا, when you get home, how are you going to take this medication? Or what side effects are you going to look for when taking this medication? Finally, set the stage for future patient contact and expectation. بنحكي للبيشنت شو مثلا متوقع في المستقبل يعني إنه يصير. أوكي. بالإضافة إلى إنه إحنا بنزوده مثلا برقم التليفون، إلى ممكن إنه بالصيدلية ممكن يتصل في عليه المريض بأي وقت عشان مثلا إذا بيسأل عن إشي معين. It is important to tactfully hands to the patient the interview is ending in conjunction with non-verbal cues. Get up from the chair or change your stand. يعني لما بدك تيجي تنهيها المقابلة بتشعره طبعا عن طريق كيوز معينة. ممكن إنك مثلا توقف من المقعد تبعك، أو مثلا تتحرك مثلا باتجاه مخالف للاتجاه اللي أنت طبعا توجه نفسك، مش إنك تروح وتتركه أكيد، بس بحيث إنه يشعر المريض إنه أنت you are going to end the interview. A simple closed-ended question such as do you have any further question؟ هاي مثلا السؤال لحاله بيعطي هنت للمريض إنه هو خلص يعني هاي آخر شيء وأنت رح تنهي المقابلة معه. And finally, this is the slide which summarizes the whole lecture. You can go through it and read it. So this is the end of our lecture for today. Our meeting will be on Wednesday at 7 o'clock as usual. Please try to read the lecture, to listen to the record, so you can ask about any questions if there is any gap. Secondly, I will talk about the project that you will make. So try to attend the lecture on Wednesday. Thank you for listening and see you on Wednesday, inshallah. Bye-bye.